Welcome and thank you so much for joining us today. My name is Gemma O'Hanlon and I'm a Senior Food and Nutrition Advisor at the Heart Foundation, and I'll be your host for today's event. Now, do we have an action-packed session for you today? The session will run for 1 hour and we have two fantastic speakers who will be talking all things dietary patterns. Now, to start off, the Heart Foundation would like to acknowledge the traditional owners and custodians of country throughout Australia and acknowledge their continuing connection to land, waters and community. We pay our respect to them, their cultures and elders past, present and future. Now, we have over 700 people that have registered from all across the country. So once again, thank you for joining us. And for some of you, it might be lunchtime, others breakfast, and others morning tea. So whatever time it is and whatever you're preparing, I hope it's a delicious meal. So while we cover some of the housekeeping items, feel free to say hello to everyone in the chat box and tell us what you're eating or about to eat. This webinar is about food and nutrition after all. Or you may want to share a tweet or a story with us with your key takeaways. And you can find us at Heart Foundation on Twitter and Heart Foundation AU on Instagram. Okay, let's run through a couple of housekeeping items and then we'll get straight into the presentations. Firstly, you'll see at the bottom of your screen, there is an option to say hello in the chat box, and there is also a Q&A box. So we'll be holding a Q&A session at the end of the webinar. So if you have a question as we go along, please feel free to pop it in the Q&A box. We won't be responding to any questions through the chat box, just the Q&A box only. We'll do our best to cover as many questions as we can. And also just a note that, of course, Sarah, as the new chair of the Dietary Guidelines Committee, won't be able to comment on the dietary guidelines specifically today due to our confidentiality obligations, and any questions are best directed to the NHMRC. Now, we know that you're going to get your hands on the slides from today's session, and I can confirm that these will be sent out to you in the next couple of days. We're also recording today's session, so once you receive the recording, please feel free to pass it on to any colleagues who might benefit from it. Also, make sure you check out the Heart Foundation website. We have over 300 recipes, which are all heart healthy and delicious options. And we take great pride in developing our recipes, photographing and styling them so that they look and taste delicious, and we can reach as many people as possible with our heart healthy eating patterns. All right, let's talk about today's topic. Coronary heart disease continues to be the leading cause of death in Australia. And it's not surprising that poor diet is the biggest contributor to the burden of heart disease, followed by high blood pressure and high cholesterol. In recent years, the research into heart disease and nutrition has shifted from a single nutrient approach towards dietary patterns. So today we're going to hear from two expert speakers, Professor Sarah McNaughton and Heart Foundation dietitian Sian Armstrong. Professor McNaughton is a nutritional epidemiologist in the School of Exercise and Nutrition Sciences at Deakin University, Deputy Director of the Institute for Physical Activity and Nutrition, and leads the Dietary Patterns and Eating Behaviours Research Group. She is an accredited practicing dietitian, a fellow of Dietitians Australia, and a registered public health nutritionist. She completed her PhD at the University of Queensland in 2003. Professor McNaughton leads a program of research that focuses on the role of foods, eating patterns and dietary patterns in health and wellbeing, and the translation of dietary patterns research into nutrition strategies, practice and policy. She has served on a range of national and international committees and advisory groups for the World Health Organization, Australian Chronic Disease Prevention Alliance, Heart Foundation and Nutrition Australia. And in September 2021, she was appointed the chair of the NHMRC Dietary Guidelines Expert Committee. Sian, our second speaker, is an accredited practicing dietitian with an in-depth knowledge of public health, food and nutrition. Sian has worked at the Heart Foundation for over 6 years, where she is currently a senior food and nutrition advisor. Her role involves providing expert nutrition advice, both internally and externally, and leading the communications and health professional engagement aspects of the nutrition program. Okay, well, that is enough from me. let's kick off the presentations. So Sarah will be talking first and Sian will follow directly after. So Sarah, I'll ask you to turn your video on and I'll hand over to you.
Thanks, Gemma, for that very warm welcome, and welcome to everybody here today. And thank you to the Heart Foundation for the opportunity to speak today. I'm going to speak today on a topic that's really close to my heart, and that is dietary patterns and health and the evidence that underpins our development of guidelines and nutrition translation. So nutrition science has been evolving over the last 100 years to tackle a whole range of diet and health problems. This BMJ summary paper from a couple of years ago presents a beautiful outline of this evolution of our understanding of nutrition science and its impact and role in understanding the nutrition and health relationships. As I said, nutrition science has evolved, and it's really evolved from an initial focus on solving problems of deficiency diseases to issues relating to chronic disease. And that evolution in the types of problems that we've been looking to solve has also changed the types of approaches that we need to think about. So we've moved very much from a nutrient-focused perspective, solving issues around deficiency diseases, to a dietary patterns focus for chronic disease. If we think about dietary intake, it's a really complex exposure, and there are multiple levels and layers that we might think about when we're trying to understand dietary intake and its impact on health. And we have traditionally thought about nutrients, as I mentioned before, but nutrients are packaged up into foods. We eat foods together in eating occasions, and then overlaying all that is our total dietary pattern. And so when we're thinking about the concepts of dietary patterns, the sorts of ideas and concepts that you might take away that we're trying to capture the total diet, not just individual foods or individual nutrients. They are a composite or summary measure of dietary behaviours. And when we use methods and approaches to assess dietary patterns, we're trying to really get at that multidimensional or complex nature of diet. I like to have a look backwards to understand where we've come from and understand how long these concepts have been developing in the field of nutrition science. And we can look to some of the very early papers, go back as far as 1981. And this is a series of papers here in 1981 in the US, often quoted as the very first papers. Interestingly, though, Australia was right there. There are published papers going back that far looking at these concepts of dietary patterns. And if you know, these are quite some famous authors in epidemiology. However, it probably wasn't until the 90s that the concepts really started to emerge and become more mainstream. And this paper on colon cancer really is considered one of the sort of seminal papers that really started to see the uptick in research. And there was a nice review done a few years ago, which really showed this real uptick in publications and research around dietary patterns. And it stops at around 2012, but I think you would see this graph go off the curve quite substantially now. And in the 90s, when this work was really starting to take force in epidemiology, it also aligns with where we saw a lot of the intervention trials at that time starting to take us. And so that was the time in which interventions where they were manipulating multiple aspects of the diet, such as the DASH trials and the seminal Leon Diet Heart study, where the intervention was actually multiple components of diets being changed. And so this really shifted the ideas towards dietary patterns. Fast forward to now, and Nourishing Australia is the decadal plan for nutrition science in Australia. And this was released in 2019. And throughout this document, you can see that dietary patterns really are at the forefront of what we think is going forward in nutrition science. The terms dietary patterns appears about 29 times in a 40-page document. I think that shows how much it's really become quite mainstream and really the way to go in nutrition science. So why might we examine dietary patterns? Well, a dietary patterns approach acknowledges that there are interactions that might occur between different food components and food constituents and recognises those cuisine elements to food combinations. It also acknowledges that there are potentially unknown components in our foods with biological actions, but also the food matrix elements to our food intake. This approach also acknowledges that there may be small changes or small differences in individual food intakes that may have cumulative health benefits. And so by examining the total dietary pattern, we may be able to account for those small impacts. And also a really important concept in nutrition is that balance concept. So the balance between the protective and the harmful components of diet may be something that's really important and that dietary patterns approaches allows us to capture. So I want to say a few words about different approaches, and I'm not going to go into great detail because there's a lot of nitty-gritty there that you might not be particularly interested in, but I think it's important to understand some of the approaches, some of the terminologies, and what those different approaches might tell us about nutrition and health. And fundamentally, there are two different approaches: data-driven approaches and investigator-defined methods, and I'll come and tell you a little bit about each of those. So when we think about data-driven approaches, we're really talking about letting the data tell the story about the dietary patterns. So we use multivariate statistical techniques to analyze the data and understand what the underlying patterns in that data are. Dietary intake is highly correlated, and what I mean by that is that certain foods tend to go together in diets, and certain types of foods go together. So for example, we know that people that drink skim milk tend to eat more whole grain breads and cereals. And so sometimes that's been considered as a disadvantage when we're trying to undertake research in nutrition. But dietary pattern approaches actually capitalize on that correlated nature of dietary intake. A really important consideration or understanding for dietary patterns is when you use these approaches, it actually tries to describe what's going on in the population. We don't put any preconceived notions of dietary patterns into the research. We let the data drive the story. And the sorts of terminologies that you'll see in the literature around these approaches are things like factor analysis or principal components analysis, cluster analysis, and reduced regression. The most common approach that, across the literature for data-driven approaches is principal component analysis. And what this is trying to do is it's trying to define these factors that explain variation in food intake. And so foods that are consumed together and whose consumption is highly correlated form those dietary patterns. And what we're really trying to ask is, does consumption of this combination of foods impact a health outcome? And we've done some work using this approach in quite a lot of studies, but one here where we were looking at dietary patterns of older adults. And you can see we had a classic sort of unhealthy pattern with lots of discretionary foods, a pattern that was predominantly fruit and salad vegetables and fish, and then a pattern that was really all the cooked types of vegetables. And we went on to look at those in terms of various health outcomes. Probably one of the most well-known international studies that contributes to nutrition epidemiology are the Nelson's Health Study and the Health Professionals Follow-Up Studies. And they have done a lot of work looking at dietary patterns, and they have identified these two core patterns in their data set. So the prudent patterns and the Western pattern. I'm not a great fan of that terminology around prudent, but it's what we're kind of stuck with. So they've done extensive work to look at these dietary patterns and shown that they relate to a number of different kinds of health risk factors. In terms of data-driven approaches, of course, there are challenges with using these methodologies. As I noted, there's multiple different methods that can be used, and some aspects of those methods are really well defined and well understood, and some applications of them are not as well understood and are not well defined. And I guess the other thing to point out is that when we use these methods, because we let the data tell the story, the dietary patterns don't always reflect our current knowledge or guidelines on what optimal eating patterns are, because we know dietary patterns in the population are not necessarily optimal. The next big group of approaches is the investigator-defined approaches. And when you look at the spread of literature out there in the dietary patterns world, this is predominantly the methods that are used, quite overwhelmingly. And what do I mean by investigator-defined methods? Well, this is where we take pre-specified criteria, usually based on guidelines or our recommendations or previous knowledge, and we define the attributes of the dietary patterns, and then we set criteria and cut points to see how well people match up to those particular dietary patterns. And the most common terminology in the literature you'll see around this is diet quality scores. And commonly that sort of terminology is where we're trying to operationalize compliance with national dietary guidelines. couple of other more emerging approaches, or some well established. For example, we can use dietary patterns methodology to reflect predefined diets, such as a vegetarian diet, where we know what we are setting up as the characteristics of that diet, and we describe people according to those characteristics. More emerging is the use of what I might call single attributes, such as the level of processing in a diet, or the level of plant-based foods or animal-based foods. In terms of a number of the diet quality indices that you'll see in the literature, you'll hear about the Healthy Eating Index, which is the US-based dietary guidelines score, but these other ones are also really quite common as well. So the recommended food score, Mediterranean diet scores, there's lots of different ones of those around, but there's lots of common elements to that Mediterranean diet. And a more recent one that's gaining traction in the literature is how we look at plant-based diets. We had a look at diet quality in the Australian context and developed a score to assess how well dietary intakes aligned with the dietary guidelines. We developed that with the old guidelines and then updated that to reflect 2013 as well. We developed a food-based comprehensive score so that it reflects food intakes and tries to capture all elements of the dietary guidelines. And we've looked at that dietary guideline index in a range of cohorts and with a range of different health outcomes. We did some work with the Heart Foundation a few years ago to look at diet quality in the Australian Health Survey. And one of the particular things we were interested in was understanding diet quality and its associations with socioeconomic position. And we were able to show that quite clearly there are gradients in diet quality in the Australian population, so that those with higher education levels tended to have higher diet quality. Also, looking at the National Health Survey, we were able to show those with high diet quality had lower rates of obesity and lower rates of hypertension. What are some of the challenges that we might face when we look at investigator-driven methods? Well, one of the problems is that from a research perspective, very few participants are actually often consuming in line with the dietary guidelines. And so that can create a lack of variation in the population, which can make it difficult to examine from an epidemiological perspective associations with diet and health. And I guess one of the other barriers is that there are a large number of existing indices worldwide. And so that variation in the research and the methods that are used can impact how we then look at translating that into guidelines. So let's move on to thinking about how we might translate and implement some of this evidence into dietary patterns from dietary patterns research. We can see from this slide that many organisations, both in Australia and worldwide, are looking towards moving dietary guidelines and dietary advice to a more dietary patterns approach. And we can see the World Cancer Research Fund, we can see WHO and FAO together, Public Health Association, US dietary guidelines, and of course the Heart Foundation. And there's now a global consensus around moving in this direction. So we look at the US dietary guidelines, and they've been moving in this direction since the 2015 guidelines, which was the first time that they used systematic reviews to examine the evidence on dietary patterns and health outcomes. And they extended that process with the most recent ones that were published last year and conducted extensive systematic reviews across a whole range of health outcomes. Similarly, we can look at the World Cancer Research Fund and see their evolution from their major reports into diet and cancer. Back in the 1997 first report, dietary patterns wasn't a concept that was mentioned at all. When we moved to 2007, we can see them starting to incorporate the evidence, conduct systematic reviews, but conclude at that point in time there wasn't enough evidence. But now when we see the most recent report, I think it's around 2018, they have published systematic reviews in this area and have incorporated evidence, particularly around obesity and its relations to cancer risk in relation to dietary patterns. So we can see that evolution, that the field is moving in this direction. In our own dietary guidelines, where are we at with the 2013? So this is some work that was conducted by a PhD student working with me, Kate Wingrove, And she's looked at the systematic reviews that underpinned the 2013 guidelines to look at how much were dietary patterns kinds of approaches considered in that work. And we can see predominantly the exposures that were looked at were foods. There was a small amount of nutrient evidence used and a small amount of dietary patterns evidence. Now, this is to be expected. The dietary guidelines in 2013 were an evolution from the previous guidelines, moving towards food-based guidelines. And dietary patterns was an emerging concept at that time. The other comment to make is that we can think about food evidence and bringing together all that food evidence is another way of thinking about dietary patterns. And of course, you're going to hear from Sian in a few moments all about the Heart Foundation's work in this space. So what are some of the challenges when we think about translating the evidence from dietary patterns into guidelines? Well, despite the massive increase in research, there still are gaps in our evidence base. This is some work we did a few years ago to look at systematic reviews of dietary patterns and health outcomes. And you can see cardiovascular disease, there's quite a lot of the work in that space, but there are other health outcomes where there are still gaps, and perhaps things like mental health and cognitive health are places where we need further research. There are population groups, perhaps not as of interest to this particular audience, but if we look to evidence around dietary patterns for children and adolescents, there is much work to be done in that space, particularly if we look at the life course impacts of dietary patterns. And if we're thinking about international guidelines, there is a dearth of evidence across low and middle income countries. And I guess the other comment is the balance of Australian research to international research. Sometimes we do like to understand the Australian context when we're looking at dietary guidelines. And so there is less research in the Australian context than internationally. From a methodological perspective, there's quite a lot of variability in the methods used. So those different approaches and the different applications of those approaches. And I guess the key message here is that it can be then difficult to understand whether differences in results are actually a methodological issue or whether they are real differences in results. I think one of the challenges that perhaps we need to work through when we're thinking about dietary patterns evidence is that they don't always provide quantitative recommendations. So particularly with the data-driven methods that I was mentioning earlier in the presentation, we were looking at patterns in the data. And so we need to go that one step further when we've identified the patterns to then go and say, well, if someone is rated as consuming in line with that dietary pattern and is a high consumer of that dietary pattern, what does that actually mean for quantitative intakes of particular foods? And I think a real challenge and a really important consideration is how do we go about taking evidence from our different levels or layers of exposures and integrating that information? When is it appropriate that we use dietary pattern methods? When should we look to nutrient or food-based approaches? And how and when do we need to integrate across that continuum? And the final challenge that I'll put forward for looking at dietary patterns evidence is that when we develop guidelines, we have to do quality assessment of the individual research studies that underpin the guidelines. And many of those quality assessment methods have been developed in the medical field or for pharmacology, and they tend to prioritize randomized controlled trials over observational studies. Now, dietary patterns evidence is predominantly evidence from cohort studies. We're studying complex intakes in the population and health outcomes that develop over years and decades. And so cohorts can provide really important evidence for those research questions. So just in summary, dietary patterns is a concept that's now really embedded in nutrition science. It can provide really important insights, both into the associations with health outcomes, but I think also in understanding dietary behaviours. We're now moving towards evidence synthesis and translation, and that's a real key issue in how we do that with this kinds of evidence. And we also need to think about from a research perspective in terms of where are the gaps and where do we need to be moving forward. We need consensus in their use and their application and their reporting so that we can use that evidence into guidelines, because fundamentally that's what we want to do when we conduct research, is have an impact on health. And just finally, I'll make one last point. I think it's really important to really consider that continuum of dietary intake. I've done a lot of work at the dietary patterns end of the spectrum, but it doesn't mean that those other levels are not important. So when is it important to use nutrients and foods? How do we integrate that? When is it appropriate to consider a meal-based approach? And some of these different approaches might be really important when we think about how we translate messages of the dietary guidelines into action for consumers. So I'll leave it there now, and I'll hand over to Sian, who's going to take you through the Heart Foundation work.
Thank you. Hang on, let me share my screen here. Thank you. All right. Good afternoon, everyone. And thank you so much for that, Sarah. My name is Sian Armstrong. I'm a dietitian and a senior food and nutrition advisor at the Heart Foundation. And like I said, I just want to firstly thank Sarah for that really wonderful presentation. It was so insightful, and I think it's really set the scene well for me to talk to the Heart Foundation's work in dietary patterns. So to begin with, I'd just like to acknowledge the traditional owners and custodians of country throughout Australia and their continuing connection to land, waters, and community. We pay our respect to elders past, present, and future. So as a quick overview of what I'll be speaking about today, I only have about 15 minutes, but I'm going to spend the bulk of my time talking to you through our evidence generation process and then our heart healthy eating recommendations, including our latest evidence on meat, eggs, and dairy. So to set the scene, I just wanted to touch on why diet is so important when it comes to cardiovascular disease. I've got some stats up on the screen to illustrate the point, but I guess one of the most powerful ones is that poor diet is the leading contributor to the burden of coronary heart disease, accounting for 66% of the total burden. We also know that coronary heart disease is the leading cause of death in Australia. And unfortunately, Australian diets are currently quite poor, with most adults and children not eating enough fruit or vegetables, and over a third of our intake coming from discretionary foods. So like I said, I'll now spend a little bit of time talking you through our process for evidence generation. Since 1967, the Heart Foundation has developed and maintained a range of food and nutrition evidence-based papers and corresponding position statements. On this slide here, you can see our evidence reviews that we have on the left-hand side of the screen and our current position statements on the right-hand side. Our papers has covered the role of specific foods, as well as nutrients, right through to dietary patterns in heart health. Okay, so I've got a bit of a diagram to show you the key elements of the Heart Foundation Food and Nutrition Team's evidence development process. Step one, identify the issue, which is quite self-explanatory, but there are a number of reasons why we might decide to do an evidence review. So we might have new evidence emerging that suggests our current recommendations are no longer appropriate. We might have recommendations in comparable countries changing. We might see a big global report published. Someone might highlight a gap in our understanding or our messaging, or there might be a business need. So we could have a program that needs some evidence to guide it or underpin it. Then once we've decided that an evidence review is required, we have to come up with a research question and decide on the method for the evidence review, which we do in a couple of ways. Sometimes we do it in-house with Heart Foundation staff, or sometimes we might commission an individual or a group to undertake the work for us. This is what we would usually do if it's a larger or a more complicated or complex topic. Then, of course, assessing the evidence is obviously one of the most important parts of the whole process. We make sure to review both peer-reviewed and grey literature, and we review many, many studies over many years. It's obviously not just about that one latest paper that's been reviewed. We used grade to assess the quality of the evidence, and we developed draft conclusions. And during this process, we usually have expert input, even if the review is being done in-house. So we'll often pull together a working group of external experts who can provide us with advice and input. Now, once the evidence is reviewed and the recommendations have been made, that's when we will create a position statement, which really takes into account the recommendations as well as the broader context. So we will take into account population trends, including equity considerations. We'll do an analysis of the international or national policy context, And we'll also have a think about any other existing Heart Foundation commentary on the topic and how this topic will fit in with the broader Heart Foundation food and nutrition position. These recommendations and the position statements are again discussed with our working group, and then they have to go through the many layers of approvals, both internally and with our expert advisory committees. So some of the outputs of this work we have, I've got listed on the screen here. So we might have position statements, we'll have a summary of evidence, and we'll develop resources, but we will also create internal documents like FAQs or key message documents, which really do help us with our dissemination. Next, we have implementation. So this stage is all about embedding the evidence and the position into Heart Foundation activities and disseminating it both internally and externally to health professionals, to the public, and to the media. Now, we do this in a number of ways. We might do it via our website, through the media, through our social media channels, and we also do it through webinars like this one to health professionals. Then the final stage is to evaluate the process of, to evaluate the impact of our dissemination. And then we will continue to monitor if any new evidence is emerging on the topic, and then we will go right back to the start and start again. So as you can see, it really is quite a rigorous process, and it's one that we're really proud of. The Heart Foundation is seen as a leading authority in the nutrition space. So we really do need to make sure that our recommendations are based on the best available evidence. As I mentioned, it's not about one paper, it's about the strength and the pool of evidence. And the last thing that I wanted to mention on this topic is that our evidence reviews and our position statements are completely independent. So there's no funding or no involvement at all from food industry. And any experts that we work with, we make sure that there's no conflict of interest there as well. So now that I've explained how our evidence is generated, I wanted to take you through our nutrition recommendations. As we've just heard from Sarah, nutrition research has moved to a dietary patterns approach. And this is a shift that prompted the Heart Foundation back in 2017 to commission an evidence review into the best dietary pattern for cardiovascular health. Now, in the interest of time, I won't be able to go into too much detail on this review, but we do have a webinar on the topic on the Heart Foundation YouTube site. So I really would encourage you to go and watch that in your own time if you are interested. So as a summary, the review looked at different dietary patterns and the primary and secondary prevention of cardiovascular disease. We saw that the DASH diet had the strongest evidence for primary prevention of cardiovascular disease. And then, depending on which risk factors were looked at, there were a number of different eating patterns that were associated with a lower risk. So one of the key findings of this work was that there were a variety of different eating patterns linked to better cardiovascular outcomes. And even more importantly, the variety of diets were more similar than they were different. So some of the similarities that we found were that these diets were largely plant-based with moderate amounts of animal products. They used fats like olive oil and nuts. And of course, they had a low intake of highly processed foods. So based on this review, the Heart Foundation created our Heart Healthy Eating Pattern, which you can see here on the screen. This was initially released in 2017, but we updated it in 2019 based on some reviews that I'll take you through in just a moment. So our Heart Healthy Eating Pattern has been designed to be purposefully simple, and it's a condensation of the similarities that we saw in the eating patterns that were associated with a lower cardiovascular disease risk. While at the same time, it does still reflect the evidence for some of those nutrients of concern, like sodium and the different types of fats. You'll also notice that our Heart Healthy Eating Pattern is food-based rather than nutrient-based, and it also has a positive messaging. And this was a conscious decision, and it really is purposely positive. We believe that it's important to highlight the foods that we should eat more of and foods that we should be enjoying rather than focusing on what to cut out. And we also talk to healthy eating patterns rather than talking about diets, just because we do know that there is a lot of stigma attached to the word diet. So following this heart healthy eating pattern will mean that your eating pattern is naturally low in saturated and trans fats, as well as added sodium and added sugar, while at the same time being rich in fiber, whole grains, antioxidants, and unsaturated fats. Okay, so I do want to quickly take you through our most recent advice on meat, eggs, and dairy. We released these reviews in 2019, but I thought it would be a good opportunity to take you through them today, as we haven't really had the chance to do this with health professionals up until now. Okay, so I'll start with eggs, as this has been a topic that's been widely debated over the years. And prior to this review, the Heart Foundation recommended that all population groups limit egg consumption to 6 to 7 eggs per week. And this was mostly because eggs are one of the highest cholesterol foods. Now, our review showed that the evidence for egg consumption and the risk of cardiovascular disease was quite mixed, but on balance, it appears that in the context of a healthy eating pattern, eggs have a neutral relationship with heart health, meaning they neither remarkably increase or decrease the risk. So for this reason, there was really no strong evidence for placing that limit on consumption for the general population. Now, the review also showed that there is a growing evidence base reporting an increased risk of cardiovascular disease associated with increasing egg consumption in people with type 2 diabetes. And there was also evidence that consumption of the dietary cholesterol that's found in eggs does increase blood LDL cholesterol levels, as well as HDL cholesterols and the LDL to HDL cholesterol ratio, which does suggest caution for those people that have elevated LDL cholesterol or existing heart disease. So our recommendations for eggs are as follows. For the general population, eggs can be included in a heart healthy eating pattern as one of a variety of healthy protein foods. Eggs can be a healthy snack option and they can contribute to healthy meals, particularly in preference to discretionary foods. But based on that evidence for the increased risk in people with type 2 diabetes, we do recommend that the consumption of eggs should be limited to 7 per week for people with type 2 diabetes. And also, since we saw that the cholesterol present in eggs can raise LDL cholesterol, we do also recommend that people who need to lower their cholesterol, so people with heart disease or at high risk, should also limit their egg consumption to 7 eggs or less per week. The next position that I'll take you through is dairy, which has also been quite controversial over the years, particularly when talking about full fat versus reduced fat varieties. So again, our review into dairy and heart health showed mixed evidence, but on balance, it appears that milk, yogurt, and cheese have a neutral relationship with cardiovascular health, again, in the context of a healthy eating pattern. And again, meaning that these products don't really significantly increase or decrease risk. The evidence did show that dairy fat does raise LDL cholesterol, but the relationship really seems to be dependent on the type of dairy product and the type of person or the person who's having it. Now, when it comes to full fat versus reduced fat, the evidence was quite inconsistent. We didn't find enough evidence to recommend full fat over reduced fat or to recommend reduced fat over full fat for the general population. So the Heart Foundation now recommends that unflavoured milk, yogurt, and cheese can be part of a heart healthy eating pattern. That means that for the general population, it's up to the individual to choose whether they want to have full fat or reduced fat varieties of these products. But for those people who require LDL cholesterol lowering therapy, or for those with existing heart disease, we do still recommend choosing reduced fat varieties. And this is really due to that LDL cholesterol increasing nature of dairy fat that I just mentioned. Now, it's important to note that the evidence for milk, yogurt, and cheese does not extend to butter, ice cream, cream, and dairy desserts, which are not part of a healthy eating pattern, and they're something that we recommend should be limited. The final position statement that I will talk you through today is meat, another area that has been widely debated over recent years. So our evidence review showed that unprocessed red meat has moderately adverse effects on cardiovascular disease outcomes, particularly when looking at stroke and weight gain. The evidence suggests that unprocessed red meat should be limited to less than 50 grams per day. Now, when it comes to white meat like chicken and turkey, the review showed that, again, it has that relatively neutral effect on cardiovascular disease outcomes, meaning it doesn't remarkably increase or decrease the risk. So based on these findings, we now recommend that unprocessed red meat can still feature in a heart healthy eating pattern, but fish, seafood, and legumes and nuts and seeds are the preferred sources of proteins, as we know these foods have been shown to have a beneficial relationship with heart health. We recommend Australians should consume less than 350 grams of lean red meat per week, which works out to be about 1 to 3 small meat-based meals a week. We, of course, still recommend people avoid processed meat as it's been consistently linked to a higher risk of heart disease as well as other chronic conditions. We didn't include a limit on consumption of white meat due to that mutual relationship. However, of course, plant-based proteins and fish are still preferred to white meat. So really the summary, you can see it in that picture on the left of the screen, with the best types of protein being plant-based ones like beans, lentils, nuts and seeds, as well as your fish and seafood. Then we have poultry and eggs in the middle as neutral, and finally red meat, which should be limited as there is that increased risk. Now, I really quickly want to take you through some of our resources that we have for health professionals and the public. So as Gemma mentioned, we do have some recipes, and our culinary nutrition workstream is one of the ways that we translate our evidence into practice. We have a set of recipe criteria and guidelines that reflect our heart healthy eating pattern recommendations and the evidence that sits behind them. But they do also take into account other priorities like budget, taste, and ease of replication. We have over 300 recipes on our website, so I do really encourage you to use these as a resource with your patients. They're appropriate for both the general population and also those with heart disease risk factors like high blood pressure or high cholesterol. And based on the popularity of our recipes, we have actually created and launched a 4-week pilot program, which we launched late last year, called the Heart Healthy Dinner Plan, which aims to translate that heart healthy eating pattern into a practical tool to help people make easier choices at the supermarket. Overall, it featured our Heart Foundation recipes, and they were organised into a weekly dinner plan, and it also included nutrition tips and weekly shopping lists as well. Some of the features include that the skill level was predominantly easy. We included meat-free meals. The cost was considered, with most meals being less than $5 a serve. We also tried to include minimal kitchenware, so we'll focus on some of those one pot and one pan dishes. And we use stop motion videos where available as a bit of a visual reference tool. And it's been a great success, so you can find it on our website, but also keep an eye out for version 2.0 in 2022. You'll be able to find all of our position statements on our website in the health professional section, as well as the evidence summaries that informed them. And we also have some resources that you can use with your patients and a public-facing website with more information on our heart healthy eating pattern. So thank you so much for your time today. I'm just going to stop sharing my screen now, and we can move over into our Q&A session with Gemma and Sarah.
Thanks, Sian. That was fantastic. And Sarah as well. What wonderful presentations. And we have had so much dialogue in the chat box. I'm loving hearing what people are eating today from Australia and across the ditch in New Zealand as well. So thank you for saying hi. And thank you for your questions. We've had so many questions come through. We probably won't be able to get to them all today, but we'll do our best to cover as many as we can. Now, Sian, the first question I might direct to you. Is a heart healthy eating pattern a healthy eating pattern?
Yeah, absolutely. That's a great question. A heart healthy eating pattern is absolutely still relevant for just the general population for preventing heart disease, but it's also great for general health as well, which is why I was saying as well, our recipes are really good for your general population and to use with your patients as well, but certainly very appropriate for just general healthy eating as well.
Excellent. And a question has come up around environment, and I might throw to you, Sarah. Does the dietary patterns evidence include environmental evidence?
There is emerging research being conducted to look at the associations between dietary patterns and sustainability, definitely. So yeah, watch this space very much. Excellent.
And Sian, a question has come up about nuts. Can you please comment on nuts? What's new and how are they beneficial in reducing cardiovascular disease?
Yeah, sure. So nuts definitely feature in our heart healthy eating pattern. They are a good source of healthy fats. So we certainly recommend people take them as a good source of healthy fats, but also as one of those healthy protein foods. So we know they have those good fats like monounsaturated fats in there. So we certainly recommend that people, use things like nut butter, snack on nuts, unsalted, of course. And use them as a protein source as well. So yeah, I mean, we certainly recommend nuts.
Beautiful. And one for Sarah now. So I think there was a question about your slide, Sarah, with the circles. And is it possible to include dietary patterns on the outer circle and with food in the third tier so that for the general population, we can have recommendations based on dietary patterns using foods, especially not ultra-processed foods?
I guess that's a really interesting question. I guess what I put up was really just a conceptual framework of how sort of diets, what the continuum of sort of different exposures are. I guess the answer is fundamentally yes, because I guess dietary patterns are made up of foods. That's what that diagram is trying to. So if we make recommendations about foods to consume more of or to consume less of, then of course that would fit within a healthy dietary pattern.
Beautiful. And another question for you around the food system. So the question is, how do you see evidence from dietary patterns methods drive food systems work in local councils and regional healthy eating work occurring right now? So how do we integrate the data and current gaps to guide public health nutrition outcomes and local impact?
Look, I think there's a few ways that it could drive that kind of work. I guess dietary recommendations, dietary guidelines at the population really set the scene for how do we support healthy eating in the community and what should the food system look like. So I think at that level, I think from a perhaps a more researcher perspective, I think some of the methods when we think about dietary patterns might help us evaluate some of our interventions. How well is the population tracking in terms of their dietary patterns overall? And also when we're thinking about developing interventions, that we can again use them for evaluating our impact and outcome. Where are we having impact? So there's a number of ways I think that it might work and be useful.
Wonderful, thanks, Sarah. And a couple of questions have come up around dairy and the use of obviously unflavoured dairy. Sian, did you want to talk to that one in terms of the recommendation for unflavoured dairy products?
Yeah, sure. So we do recommend unflavoured milk, yogurt and cheese. And I guess the main reasoning for that is because we know that some of those flavoured products do have either a lot of added sugar or maybe some artificial sugars, which is not something that we recommend at the Heart Foundation. So it really is mostly as simple as that around trying to make sure that people are having less added sugar. I think in the paper that we did on dairy, some of the researchers did make comments that the association with milk and yogurt being linked with better health outcomes were unlikely to apply to some of those really highly flavoured sugared yogurts that you can find in the supermarket. So yeah, we do recommend unflavoured milk, yogurt and cheese, just mostly because we know that they won't have any added sugars or artificial sugars in there.
Fantastic. And some great questions coming up around the Heart Foundation recipes. So do they take cultural preferences into consideration?
Yeah, I mean, we do. We try and have a variety of different recipes. We also have recipe booklets, so with different themes. We have different cultural cuisines as well. I mean, we are still working on getting them on our website into different categories. So you might need to bear with us and have a little scroll through and try and find what you're looking for. But we certainly do have different cuisines from, lots of recipes from different cuisines. And it's something that we are always trying to improve on. We're always developing new recipes. So if you've got ideas, feel free to shoot them through and we can take them into consideration when we develop our next set of recipes.
Fantastic. Okay, I'm just going through. There's so many questions coming through. Can the Heart Foundation's heart health eating pattern recipes be scaled to a commercial environment, for example, cafes or food service?
That's a good question. Yeah, I mean, you can give it a try. Why not? And if anyone is interested in working with us on recipes or have more questions about the recipes, I would encourage you to get in touch. I think I put my email address on my final slide. I think it's also attached to the Zoom. So do feel free to get in touch if you have any questions like that. I mean, I think you could certainly give it a try, scaling them to commercial cafes, and we'd love to hear how it goes. They do have, at the moment, recommended servings, and it's usually around 4, I think. So, usually more aimed at the family, but certainly give it a try and let us know how you go, or get in touch with a question and we can try and help you out.
Excellent. And there's been a couple of questions around saturated fats and what is the Heart Foundation position in terms of saturated fats and cholesterol?
Yeah, so we do, obviously we take the dietary patterns approach and the food approach where we try and talk about the foods rather than, particularly when we're talking to consumers, we're trying not to confuse people with all the different types of fats. And, we know that all different foods have got different ratios, so they will have lots of different types of fat in them. We do still recommend reducing saturated fat intake and replacing it with healthier fats like mono and polyunsaturated fats. But we try and do that by telling people about what foods to eat. So, you know, avoiding discretionary foods or unhealthy foods, and eating more of the healthy foods like fish and nuts and seeds. And by telling people to eat those foods, we hope that that means that it will reduce the intake of saturated fats and increase the intake of the mono and polyunsaturated fats.
Beautiful. And another question to either of you, when talking about foods, how do we talk about foods to eat plenty versus foods to eat sometimes without stigmatizing foods? It's always a tricky one.
I mean, I'll go first if you want, and then Sarah, you feel free to jump in. Like I mentioned in my presentation, we do try and take that positive approach to talking about food. We really try and focus on telling people what to eat more of rather than constantly telling people what to cut out, because there is that stigma and there is a lot of talk about diets and, you know, cutting out this food. And also if you're just constantly telling people what not to eat, when it comes time to choose what to eat, they might be a little bit confused because they know they can't have this, can't have this, can't have this, but what can they eat? So yeah, we really try and focus more on telling people what to eat and focus less on what not to eat. And we sort of hope that by having our heart healthy eating pattern, anything that doesn't fall into that heart healthy eating pattern is sort of something that we would recommend. I think we say sort of having sometimes and in small amounts, but it is really tricky to everyone's idea of sometimes is different. So it is tricky, but yeah, we just try and focus on the positive for sure.
And Sarah, did you have a comment?
I think the only thing I would add is I think we actually need to do much more research on consumer understanding of the kinds of messages that we're putting out there in diverse groups across the community, because I think what we think we might understand, other people may not understand that way. So I think much more work needs to be done on that kind of the actual translation of messages and how do people understand it, what do they take from it to implement. So that would be my recommendation.
Absolutely. I mean, we can have our recommendations, but we've got to get people to actually make that behaviour change, don't we? And Sarah, another question for you. If we were to look into researching dietary patterns for children and adolescents to build the evidence base around healthy eating requirements in the early years, where do you start regarding ethical data collection?
Oh, look, obviously ethics is fundamental to all research, and you know, we have NHMRC guidelines around these things for how you conduct research with children. It's in around informed consent and how you collect those measures and all of that. So there are lots of, you know, very serious protections around that issue. And I think, you know, we need to also think about how difficult it is to collect some of that data in children and adolescents in terms of getting participation in studies and things. So really critical issue. And I think probably not something that I'm an expert in, but thinking about co-design research and how you get community participation in research. So working with participants rather than just bringing them into design studies that are already there. So I think there's lots of ways to tackle those issues.
Fantastic. And there's been some suggestions come through as well in the Q&A box around some cooking classes with Heart Foundation recipes. So I think that sounds fantastic. And of course, you can go to the website and access the recipes on the website. And yeah, we hope you really enjoy them. There's lots of different varieties, and a big call out as well to Maria, one of our team members. She leads our culinary nutrition area and does a fantastic job. Well, I think we might have to call it a close there, and we will do our final wrap up. But before we do our final wrap up, I'd like to just hand over to both Sarah and Sian, and for them to share their final key takeaway that they'd like us to take away with us today. So we'll go to Sarah first.
Thanks, Gemma. I think I'd just like to reiterate that I think dietary patterns really has emerged as a really important field, and we're now getting to the point where we are using it in translation. But we do need to think about that balance. Where do we put all that evidence together, and don't throw the baby out with the bathwater is probably what I would say.
Great. And Sian?
Yeah, I mean, I think, as I've said, I think as health professionals, when talking to patients, I would really encourage you to take an approach of talking about foods and not nutrients, and to be positive about food. We know that people eat food, they don't eat nutrients. And while, like Sarah said, we still need to consider nutrients and almost as markers rather than telling people what to eat in terms of nutrients. I just think it can be really confusing for people, but we don't need to make it more confusing if we just try and encourage them to enjoy food and enjoy more of the healthy foods. That's what I would encourage you as health professionals to do with your patients.
Beautifully said, Sian. Yeah, couldn't have said it better myself. Such a nice way to end, I think, reminding people about the joy of food. And yeah, I just want to thank everyone for coming today, joining our webinar. We've been so excited to have so many people come, and hopefully we can do more of these. We do have a survey that you will receive straight after the webinar when it comes to a close, and we'd love your feedback. So we'd love to know what you'd like to see next, and how we can continue to improve. Your feedback is really valuable. We'll also be in touch with the slides and the webinar recording. And of course, please feel free to share that on with any colleagues who would benefit from it. And finally, Sarah, thank you so much. It's such what an opportunity to have your expertise here today. And also to Sian, I just wanted to say a big thanks to Sian. Sian has worked tirelessly behind the scenes to bring this webinar to life. And Sian, you've done an incredible job. And from all of us at the Heart Foundation, we really want to thank you. So until next time, we hope you have a wonderful day ahead. So take care and goodbye for now.
Thanks, Gemma.
Thanks, Gemma. Thanks, Sian.